most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today I had a patient, Brad, that he texted me, and I'm not treating him right now, but he's having trouble with carpal tunnel. So I want to make sure it wasn't his neck, his shoulder, but it can also.
So you had a
be from-
patient years ago, and now
Yeah.
he's got your number, and he's texting you.
Right.
Okay, that's a
Right.
good situation.
So he did have further testing now, and it's probably from his neck.
Mhm.
But I want to go over the tests, what you could even do yourself.
Wait, he thought he had carpal tunnel that it ended
Right.
up being in his neck.
Right,
Oh,
exactly. And that's quite often the case.
yeah, it can be
So-
those two symptoms are similar.
Right. So when you have carpal tunnel syndrome, quite often you're going to have numbness or tingling or pain in the thumb.
Yep.
What's that? The
The pointer
pointer
finger.
finger, middle finger,
Yep.
ring finger, half the ring finger.
Sure.
So, and you also maybe have a little bit of atrophy in the tenor eminence.
Right. That spot right there. Yeah, because we're talking about the median nerve.
Right.
Right, because there's three nerves that feed the hand, and those area that you just mentioned are the median nerve.
When I say atrophy, the muscle has wasted away.
Because the
bit.
nerve is not telling it to
Right.
function, and then it just
Your strength is gone too.
Yep,
I mean.
exactly.
So we're going to go over to some of the common tests here. And I was surprised, Brad. A lot of these tests are considered poor. Like they're not good indicators.
Right.
They're not-
So if it's positive or negative, it may be
Yeah,
50-50.
right.
But we'll go through them
I
because
think that's still good to do.
yeah, and if you're positive on all of them,
Right.
there's probably a good indication that you
Yeah,
do have carpal
I
tunnel.
think that-
So we got 4 of them. We're going to go
Right.
through. They're pretty simple. You can do them.
Let's go phalanx first.
Okay.
So phalanx, you basically are going to look like you're praying.
Right. So hands like this and keep the palms touching. Is that
Right. And then you lift the elbows up.
Yeah.
And for, I don't know, they don't always say how long, but
30
maybe
to 60
36
seconds, I
minutes,
believe.
sure.
Hmm.
And you're looking for your symptoms to get worse.
Right.
So
That-
the numbness, the tingling, the pain
Exactly.
recreates.
Hmm.
Now I've seen reverse phalanx too.
Yep. Right. Going this way. And all we're doing is stressing.
Trying to compress the tunnel.
Right. And which will compress the nerve. What's happening is you got all these tendons going through that carpal tunnel and the median nerve, and it gets too compacted together, and then it
Right.
pinches the nerve, and you get the numbness, etc.
So if you're looking at where the median nerve goes, it goes right between these two meaty parts of your hand.
Mhm.
So the next test, you're going to do Tinel test, which is tapping on the nerve. So you're going to tap right between
Yep.
those two meaty parts.
Now this, when I do this, I usually go 30 seconds. I may go longer,
Yeah.
and then it's irritating. And then, like, because my wife had this, and I've done this on
Right.
hers, and then she says, "Stop it!" It
Yeah.
creates the symptoms down into her hand. It's not fun, especially if it's flared up.
All right. Next one is actually a compression test where you just take your thumb and push on that same spot.
Right, which makes sense. You're just
Yeah,
compressing all
30
those
seconds.
tissues and turn on the symptoms.
And like I said, look for atrophy. I think
Mhm.
that's a good sign. This is a new test I saw, Brad, and it hasn't been studied a lot, but when it was studied, it was very accurate.
Okay.
So basically, you just put your hands above your head and for 2 minutes, and you're looking for symptoms.
Well, you're gonna get tired shoulders.
I know. That's a long time, but you're
Uh,
looking for it to decrease your symptoms again.
Okay.
So, the final thing, if you want to do one neck range of motion, you could do, let's say it's on the right side here. I turn to the right and go back, extend back.
Yeah. So if
If
we do it
that
this way,
closes the holes down where the nerves come out.
Yep.
And so if it is coming from your neck, that might make your symptoms worse too. It could be both,
Sure.
your
Yeah.
neck and your
The double
carpal tunnel.
crunch
Yep,
syndrome.
double crush.
Right. So
So-
when we do this, we're pinching that median nerve at this location versus this location, which can give you similar symptoms,
Right.
almost the same symptoms.
Right. That's it. Give them a shot. I think, like Brad said, if they're all positive,
Right.
meaning they all give you symptoms, the likelihood of if you have CTS or carpal tunnel syndrome
Mhm.
are higher.
And if you want to treat it, you can go to Bob and Brad YouTube and
Yeah.
just type in carpal tunnel syndrome treatment. We have a number of videos on options on how to treat it. And it's something, a lot of things you can
How's your
do.
wife doing with hers, by the way?
Good. She had surgery.
Oh,
Actually, she self-treated for like at least 6 or 7 years
sure.
successfully by using the night brace, and she did some other things that that we
Right.
talk about in the videos. But eventually, she had to have surgery, and
Sure.
it's completely taken care of. So it was a great
One side.
success.
It was
One
just one side.
one
now.
hand, yes.
Okay.
Mhm,
All right.
yeah.
Remember, Brad and I can fix just about anything.
Except for
A broken heart.
broken heart, and these carpal tunnel things are just
No.
they're not gonna. Yeah,
The
fine.
carpal honey might help you.
We're going to do a video on honey next, actually.
Yeah.
Yeah.
Very interesting.
Yeah.
So,
So very good. Take
all right,
care.
take care.